I had a bill when I was in the House to expand the definition of primary care, because the people that we're talking about, these assistant physicians, they are in statute here in Missouri, and they are in various ways in a number of states, by no means all states, however. We're the show me state, we should take the lead, but they are to provide primary care. So that's OBGYN, internal medicine, pediatrics, and family practice. But I contend that psychiatry, in other words, the mental health aspect, is also primary care. And in many definitions of primary care in a variety of settings, psychiatry is included. So I had proposed that we broaden our statute to define primary care in the basis of these assistant physicians to include psychiatry. And again, automatically, we've just bumped up the amount of individuals that are going to be available to help take care of patients. Take rural area A that needs an orthopedic surgeon, but they don't have the population base to recruit somebody to be there full time, really not even part time because of the distances and all. This company can help in finding people who then travel almost a circuit and do maybe even just a 1 day or a part day a week or every other week kind of clinic and provide those services. Rheumatology is how that particular group started. They help recruit practitioners of all different stripes to help rural and underserved areas. And they may have people who are just entering the profession. Maybe they're retired and wanting to just do part-time. Or again, they enjoy the variety. It's not local tenants, that's a whole nother area, but they can staff rural and underserved community types of hospitals and clinics, and everybody benefits. The provider gets the opportunity to continue seeing patients in a variety of settings. Patients in these more rural areas get access to specialists, because you shouldn't be penalized, whether it's with school or with healthcare, based on where you live. But clearly, you can't necessarily have 24/7 access if you're in an extremely remote area compared to what you'd find in a more populated area. So we have to figure out how to make that happen economically, conveniently, and absolutely at top quality. And so there are a number of different options, but I think we need to look at multiple solutions, and we need them now. We need them yesterday, to be quite honest with you, and it can be done. It's not like we're having to reinvent the wheel. These things exist. We have to have the courage to go ahead and implement them. And as I said, I think everybody benefits. And I'd love to be leading the charge with that. I think a lot of people don't understand these issues because they haven't thought about them. I've lived in this area for a long, long time, but I think we have such a variety of legislators. They come from all walks of life, which is fabulous and absolutely what we need. But because healthcare is such a tremendous area to cover, there's so much information you have to be up to speed on in order to make proper decisions. I would love to create or to spearhead a healthcare caucus in the legislature, nonpartisan, and again, not to promote certain issues, but to educate about the topics that legislators are going to be confronting when they do their jobs. That way they'll be able to ask questions, understand issues, know where to research, know what are legitimate sources of information. And that is sorely lacking, I think, but it's something that, again, kind of smacks you in the face when you sit back and think about it. We have other kinds of caucuses to help people understand issues, but why would you not have a healthcare caucus?